Welcome to Frontline News from the University of Maryland School of Medicine News Center. I'm Larry Roberts. Coming up, an unexpected research finding could help defeat malaria, and School of Medicine faculty provide vital health education to the community. But first, School of Medicine scientists are using state-of-the-art technology to look inside the coronavirus and find new treatments. At the Center for Biomolecular Therapeutics, NMR spectrometers enable scientists to see how protein atoms interact in the presence of a magnetic field. It's how CBT researchers are testing different drug candidates to evaluate their potential as an antiviral medication to fight COVID-19.
We're able to collect information on the chemical environment of every single proton or carbon or nitrogen within that protein. And it gives us information about which ones are next to each other and basically allows us to build a model of the structural environment of these proteins.
The CBT is part of the Institute for Bioscience and Biotechnology Research. Both directed by Dr. David Weber, the Institute shares resources across the university system, saving time and money.
The equipment is extremely expensive to purchase and to upkeep, and so we share the costs and expertise. So the expertise around all of this equipment is also in place so people don't have to reinvent everything every time they want to do an experiment.
At the IBBR, School of Medicine scientists use a state-of-the-art cryogenic electron microscope to peer inside the coronavirus and better understand how it infects the human body.
If you imagine a parking lot on the surface of the moon and you're looking at it from the Earth, not only you can see individual cars on that parking lot, you can also tell which car has a passenger in which seat. That's the level of resolution these machines provide when we peer inside protein molecules.
Cryo-electron microscopy enables researchers to see how the spike protein latches on to receptors in the host cell.
All the pathogens need to enter the human cell, and they do it all in the same way. They find the door on the surface and they have a lock. It's like a burglar coming to your house, except the burglar in this case doesn't need to pick the lock, doesn't need to break in, it already has the key.
The goal is to identify molecules that can prevent the molecular key from working and interfere with the infection process. Because these technologies were already in place, School of Medicine researchers were able to respond immediately when the COVID-19 pandemic struck.
The word for us is ready for action, and we need to be ready for action both with the equipment and expertise. And so we had been studying infectious disease in many other places, but when coronavirus came in, we were able to keep this equipment all running 24/7, working on coronavirus projects within weeks of learning about the virus.
In our Discovery segment, an unexpected research finding could lead to new vaccines to fight malaria, still a major public health concern in developing countries. Every year, more than 400,000 people die from malaria infection. 2/3 are children under the age of 5 in sub-Saharan Africa.
The malaria parasite, or Plasmodium, is carried by mosquitoes, and when mosquitoes bite people, that parasite goes into the liver and eventually goes out into the blood. And while it's in the blood, people get fever, they feel like they have a really bad flu, body aches, headache, sometimes diarrhea, vomiting. They feel really sick. And in serious cases, people can get brain swelling and coma and even die from malaria.
Dr. Berry studied the immune response of 54 adults and 47 children in West Africa who were exposed to malaria. Dr. Berry detected an unexpected antibody type not usually associated with malaria.
That's surprising because we think about IgA usually as an antibody that develops in response to infections of the gastrointestinal system or even other mucosal surfaces. But malaria we think of more as a systemic disease we don't think about it as a mucosal disease.
Dr. Berry says it may be possible to engineer a vaccine that causes an IgA antibody response that could prevent malaria infection. Finding new approaches is important since a recently approved vaccine is not fully effective.
It's really only about 55% at preventing malaria, and so we can always try to do better. It would have a huge impact if it were taken up universally across these high burden areas, but we can still do better.
Finally, the 21st annual Mini Med School was a great success, with students from the Baltimore community learning about a wide range of health topics during 5 online sessions. In the final week, Dr. Joe Martinez talked about the Renaissance curriculum, and students heard from Dr. Destiny Martin, a former graduate of Mini Med School who went on to become a physician.
So this program motivated me to be more engaged in my healthcare, and it also opened up the possibility of me pursuing medicine in the future. What I really liked about the program is that we focused on healthcare issues that were important to the entire community. And we did it in a way that was interactive, that was stimulating and thought-provoking. And a couple of years ago, we did it in person, and I really loved that, but I love that we can still do it virtually. I like that we learned about health literacy, and that was something that I really appreciated. It taught me how to advocate for myself as a family member, but also just as a patient. It taught me those things, so I really appreciated that.
At the conclusion of the class, Dean Reese was presented with a certificate of appreciation for his unwavering commitment and support of Mini Med School. And that's Frontline News. I'm Larry Roberts. Thanks for joining us. I hope to see you again in 2 weeks.